Understanding colonoscopy. Everything you need to know before you get one. What exactly is a colonoscopy, and why is it recommended for me? A colonoscopy is a medical procedure used to examine the inside of the colon, large intestine, and rectum using a long, flexible tube with a camera at the tip called a colonoscope. It allows healthcare providers to detect abnormalities such as polyps, inflammation, or signs of colorectal cancer. It's recommended for individuals for various reasons. Screening for colorectal cancer. Colonoscopy is one of the most effective methods for detecting colorectal cancer early, when it's most treatable. Diagnosis of symptoms. It's often recommended if you're experiencing symptoms such as rectal bleeding, changes in bowel habits, abdominal pain, or unexplained weight loss. Monitoring existing conditions. If you have a history of colorectal polyps, inflammatory bowel disease, IBD, or a family history of colorectal cancer, regular colonoscopy may be recommended for surveillance. Other diagnostic purposes. Colonoscopy can help diagnose conditions such as inflammatory bowel disease, IBD, diverticulosis, or chronic diarrhea. How do I prepare for a colonoscopy? Are there any dietary or medication restrictions? Preparation for a colonoscopy typically involves cleansing the colon to ensure a clear view during the procedure. This often includes dietary restrictions and taking a laxative or bowel cleansing solution prescribed by your healthcare provider. Common dietary restrictions may include avoiding solid foods for a day or two before the procedure and sticking to a clear liquid diet. It's essential to follow your healthcare provider's instructions closely to ensure the success of the procedure. Medication adjustments may be necessary, such as stopping certain medications that can affect bleeding risk, such as blood thinners. Always consult with your healthcare provider before making any changes to your medications. Will the procedure be painful? What type of sedation or anesthesia will be used? Most patients undergoing colonoscopy experience minimal discomfort or pain during the procedure. Sedation or anesthesia is typically provided to ensure comfort. The type of sedation or anesthesia used depends on various factors, including the patient's medical history, preferences, and the complexity of the procedure. Options may include conscious sedation, often a combination of a sedative and pain medication, or deeper sedation administered by an anesthesiologist. How long does a colonoscopy typically take? The duration of a colonoscopy can vary depending on factors such as the patient's anatomy, any findings during the procedure, and the expertise of the healthcare provider performing the colonoscopy. On average, the procedure itself usually takes about 30 to 60 minutes to complete. What should I expect during the colonoscopy procedure? During the colonoscopy procedure, you'll be asked to change into a hospital gown and lie on your side on an examination table. A healthcare provider will insert the colonoscope into your rectum and advance it through your colon while carefully examining the lining for abnormalities. Air may be introduced into the colon to help expand it and improve visibility. If any polyps or abnormalities are found, they may be removed or biopsied during the procedure. What are the potential risks or complications associated with colonoscopy? While colonoscopy is generally considered safe, like any medical procedure, it carries some risks, including bleeding, particularly if polyps are removed during the procedure, perforation or puncture of the colon, which is rare but serious, adverse reactions to sedation or anesthesia, infection, although this is extremely rare. What happens if polyps or other abnormalities are found during the procedure? If polyps or other abnormalities are found during the colonoscopy, your healthcare provider may remove polyps or take tissue samples, biopsies, for further examination. Discuss the findings with you and recommend appropriate follow-up care or additional testing. Provide guidance on surveillance intervals for future colonoscopies based on the findings. How soon will I receive the results of the colonoscopy? The timing of receiving the results of your colonoscopy can vary depending on factors such as the facility's procedures and whether any biopsies were taken. In many cases, you may receive preliminary findings immediately after the procedure, with more detailed results provided after any biopsies are analyzed. What follow-up care or additional tests may be needed based on the results? Depending on the findings of the colonoscopy, your healthcare provider may recommend surveillance colonoscopies at regular intervals to monitor for recurrence of polyps or other abnormalities, further imaging tests or procedures if additional evaluation is needed, changes to your lifestyle or medical management based on the results. Are there any specific instructions for aftercare following the procedure? After a colonoscopy, you may receive instructions such as drinking plenty of fluids to stay hydrated, resuming your normal diet gradually, starting with bland or easily digestible foods, avoiding strenuous activity for the remainder of the day, contacting your healthcare provider if you experience persistent or severe abdominal pain, rectal bleeding, or other concerning symptoms. How often should I undergo colonoscopy screenings in the future? The frequency of colonoscopy screenings depends on various factors, including your age, medical history, and any findings from previous colonoscopies. In general, for average-risk individuals without a family history of colorectal cancer, screening colonoscopies are typically recommended every 10 years starting at age 50. If you have a family history of colorectal cancer or other risk factors, your healthcare provider may recommend more frequent screenings or starting screening at an earlier age. Are there alternative screening options available if I'm unable to undergo colonoscopy? Yes, there are alternative screening options for colorectal cancer, including fecal occult blood tests, FOBT, or fecal immunochemical tests, FIT, which detect blood in the stool. Flexible sigmoidoscopy, which examines the lower part of the colon. Virtual colonoscopy, CT colonography, which uses CT scans to create images of the colon. Will my insurance cover the cost of the colonoscopy procedure? Coverage for colonoscopy screenings varies depending on your insurance plan, coverage policies, and individual circumstances. Many insurance plans cover screening colonoscopies for average-risk individuals as recommended by national guidelines. However, it's essential to check with your insurance provider to understand your coverage and any potential out-of-pocket costs. In conclusion, colonoscopy is a vital tool for detecting and preventing colorectal cancer. If you're due for screening or have any concerns about your colorectal health, don't hesitate to speak with our experts. Thank you so much for joining me today. If you found this video helpful, be sure to give it a thumbs up and subscribe to our channel for more informative content on colorectal health.